CEBIS, our clinical evidence-based information service, in its present form at University Hospitals Coventry and Warwickshire NHS Trust, demonstrates the transition of a basic clinical librarian service into a fully integrated working process for clinicians to access, discuss and implement research evidence into practice. In addition to clinical work, the service has seen an increase in the number of referrals for local guidance, cross-sector pathways, business cases, corporate planning, benchmarking and research proposals. What follows are a few case presentations that demonstrate how CEBIS has adapted to departmental, team or individual working environments in an endeavour to ensure that each query raised follows a systematic process from start to conclusion.
So this is baby Hyatt, a 28-week-old baby who was born overnight. Mum came in spontaneous labour yesterday and baby delivered by normal delivery at 2 o'clock this morning. About an hour ago we noticed that the left leg looked a lot more pale compared to the right leg, and it does feel quite cool to touch. We can't feel a femoral on the left side, although the femoral on the right side is easily palpable.
Okay, let's have a look. What's the causes of a white leg?
There's some kind of local obstruction, so whether there's an arterial thrombus which is obstructing blood flow to the rest of the leg, because the right leg seems absolutely fine.
How could we investigate the white leg further?
I'm not sure about the evidence behind it, but I have seen some people use anticoagulants to try and break down the thrombus and restore the blood flow to the leg.
So I know there are some national guidelines written by BCH. It's probably a good idea to try and see what there is more recent than that.
Okay.
So Amber, could we have a look to see what the evidence of treating arterial thrombus with anticoagulants in preterm babies?
A fundamental part of this process is seamless access to full text. This requires in-depth resource planning and library staff to assist with document access and delivery, either by use of our discussion forum on the CEBIS system or by attendance at evidence in practice groups. This is becoming an invaluable tool in facilitating the discussion of challenging cases.
The EPG within the neonatal service allows all the team, including doctors in training and nursing colleagues, to question current practices, and with the support of the CEBIS team to explore and appraise current evidence, presenting findings to the departmental team, enabling revision of practice guidelines if appropriate. In this case, thorough review of the available evidence for the clinical management of spontaneous arterial thrombus demonstrated little evidence available in peer-reviewed publications. The outcome was to confirm current practices, but to suggest an area where wider consensus guidelines may be useful.
As we build on our knowledge bank of queries, we are also building on our user base, providing access to clinical expertise for cross-specialty cases and/or multi-professional opinion.
There are a few papers out there, but the level of evidence that we're looking at is case reports and small case series.
The evidence and practice groups have become an integral way in which we work in clinic, such as for this patient who had a degenerative condition. Previously we had differing views on how the condition should be managed. Now we have this evidence base which actually shows that rarely do these patients require intervention.
Well, the good news is, compared to your last visit, things look almost the same. Now, as I said last time, the presentation we've got of your eyes is a little bit unusual. So we've actually looked into the literature surrounding this topic, and it also supports what we're finding. You've got a non-sight threatening blister at the back of your eye, which is unlikely to get worse.
And certainly, in my view, the CEBIS service could revolutionise healthcare in that they could be involved in multidisciplinary team meetings to ensure patients get the right management and treatment.
CEBIS has been a fantastic service for dietitians. We use it a lot for evidence-based practice workshops, also for updating our diet sheets, making sure they're evidence-based for patients. And it's also been useful when I was a Macmillan dietitian for looking at alternative remedies that patients were often taking to treat their cancer. For example, patients that were using things like Zambrosa, pawpaw, chlorophyll, some unusual remedies, I was able to check if there was evidence-based behind that. And present that information back to patients, so it was very useful.
CEBIS plays an invaluable role in many aspects of my work. I receive regular updates informing of the latest advances in research and practice. It simultaneously supports my professional development and allows me to keep abreast of the current literature, guidance or examples of best practice. It is well known the evidence base in my specialty is quite thin, so CEBIS comes into its own, helping locate relevant and qualitative information towards ensuring we are able to provide the best possible care for our patients. CEBIS has been a valuable tool for supporting not only clinical care, but also research we conduct from the centre and service development. This is facilitated through evidence and practice groups, which encourage critical appraisal of the subject and healthy debate within our multidisciplinary team. A key example of one of the achievements is the development of an at-risk integrated care pathway across primary and secondary healthcare provision. Such a process requires accurate information at various levels of the journey. We are in a golden age of easy access to vast terrains of information and data. The CEBIS team at UHCW gives me confidence, particularly when time is at a premium, that I receive the most relevant and correctly sourced evidence-based knowledge in a timely manner to support the many aspects of my work.
Over the years, there have been numerous cases, and each one confirms why we continue to develop a model of joint working practice that facilitates change and promotes learning. In the future, we hope to build on what we have achieved by providing better service access, enabling wider expert opinion partnerships and more patient involvement. I'd like to thank the patients who kindly consented to be filmed, the clinical staff for volunteering their cases, and the CEBIS team for their continued drive and enthusiasm in maintaining the integrity of the service while at the same time moving it forward.